Hello, and welcome to Black Health Matters. I'm your host, Daly-Mack, RN. In today's edition, we will be discussing the silent epidemic of opioid overdoses in the Black community. Opioid overdoses are a major public health crisis in the United States, claiming the lives of nearly 50,000 people in 2019. While the media often focuses on the impact of opioids on the white, rural, and suburban communities, the Black community has also been hit hard by this epidemic. According to the latest data from the CDC and NIH, the opioid overdose crisis has disproportionately affected the Black community in the United States. Non-Hispanic Black individuals in 4 U.S. states experienced a 38% increase in the rate of opioid overdose deaths from 2018 to 2019, while the rates for other race and ethnicity groups held steady or decreased. In 2020, the overdose death rate among Black males 65 years and older was nearly 7 times that of white males 65 years and older. The overdose death rate for Black people 15 to 24 increased by 86% from 2019 to 2020, the largest rate increase among any age race group. These alarming statistics highlight the need for equitable, data-driven, community-based interventions that address the structural racism and barriers to care that fuel these disparities. There are several factors that make the Black community more vulnerable to opioid overdoses, such as lack of access to health care, stigma, discrimination, and social determinants of health. Black Americans are less likely to have health insurance, receive adequate pain management, or access addiction treatment than white Americans. We also face higher levels of stigma and discrimination when seeking help for opioid use disorder, both from healthcare providers and from our own communities. Additionally, social determinants of health, such as poverty, unemployment, housing instability, and exposure to violence, can increase the risk of opioid use and overdose among Black Americans. Some of the solutions and strategies that are being implemented to help fight the rise of opioid overdoses in the Black community include increasing the availability and accessibility of naloxone, a medication that can reverse the effects of an opioid overdose. Naloxone can be administered by bystanders, first responders, or healthcare professionals, and can save lives if given in time. Several programs, such as the Racial Justice Program of the Drug Policy Alliance, have been distributing naloxone kits and training to Black communities across the country. Expanding the use of medication-assisted treatment, or MAT, which combines behavioral therapy and medications such as methadone, buprenorphine, or naltrexone to treat opioid use disorder. MAT has been shown to reduce the risk of overdose, relapse, and infectious diseases, and improve social and psychological functioning. However, many Black Americans face barriers to accessing MAT, such as lack of insurance, transportation, or culturally competent providers. To address this, some initiatives, such as the Healing Communities Study, have been working to increase the availability and quality of MAT in Black neighborhoods. Promoting harm reduction practices, which aim to reduce the negative consequences of drug use, such as disease transmission, overdose, or criminalization. Harm reduction practices include providing sterile syringes and safe injection sites, offering testing and treatment for HIV and hepatitis C, and advocating for drug policy reform. Harm reduction services can also provide a gateway to other forms of support, such as healthcare, housing, or education. Some examples of harm reduction programs that serve Black communities are the Baltimore Harm Reduction Coalition and the Atlanta Harm Reduction Coalition. Enhancing community engagement and empowerment, which involve Black people who use opioids or who are affected by opioid use in the design, implementation, and evaluation of interventions. Community engagement and empowerment can help address the stigma, discrimination, and mistrust that often prevents Black people from seeking or receiving help for opioid use disorder. They can also foster a sense of agency, solidarity, and resilience among Black people who use opioids or who are affected by opioid use. Some examples of community engagement and empowerment initiatives are the Black Harm Reduction Network and the Black Voices Project. Just remember, opioid overdoses can happen to anyone who's taking opioids for pain management. Opioid overdoses in children have occurred when medication was not properly stored. I want to talk just a little bit more about naloxone. Anyone who takes opioids, lives with someone who takes opioids, or who just cares about saving lives can learn to administer naloxone. I was recently made aware of a naloxone training program online that is free. After taking a training that takes less than half an hour, you will receive a certificate that is valid for 2 years, and you can order 1 free naloxone test kit. It has 2 doses of naloxone. The website is endoverdose.net. I did it myself. I took the training, I have the certificate, I received my 2 doses of naloxone. I pray that I never have to use them, but in case I do, I have them. If you have any questions about anything that I shared today, please contact me at 252-410-1717. And always remember, Black health matters.